When it comes to the law, the reflex is to say, I just want to stay out of trouble. And of course you do, but can the law ever be your friend? Well, yes, it can, especially if you know it better than the guy sitting on the other side of the table. My guest today is an expert on ERISA, a law that is quite broad and applies to practices daily. He helps his clients apply ERISA to their benefit. He's going to give us a few tips on how to do it on this episode. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. It's usually what they want, but care is better when it's the provider of care that owns the practice because all decisions, business, clinical, whatever, are made by the same person or groups of people so that we can feel quite confident that when they're making a business decision, they know that patient care might get affected, and so they'll keep both in mind. My guest today, my returning guest today, is David Zetter. David is the founder and president of Zetter HealthCare in Pennsylvania and has over 24 years of operational and healthcare experience. He's nationally recognized for his speaking, presentations, and healthcare business expertise. He's well versed in regulatory requirements, revenue cycle management, credentialing and contracting, compliance, coding, and documentation. He's considered an expert on Medicare, not only by his clients, but also through consultant colleagues and healthcare attorneys across the country. He's an expert on ERISA regulations, which you heard is the subject of today, which protects over 80% of the claims in the US, and he knows how to stop payor recoupments dead in their tracks and what is legal and illegal in many payor contracts. David's firm works with healthcare professional clients and facilities coast to coast in all areas of practice and facility management. David, welcome back.
Thank you, Carl. Good to be here.
Yes, this is the third or fourth time. I think I've said to you, I've said to others, but to you as well, we could do a year's worth of episodes on the many, many
Probably.
facets of the simple business of private practice.
Sure.
Yeah. But for those who don't know you or haven't heard a prior episode, I want to start where I always do. Tell us more about you, your firm. Help us get to know you a bit better.
Well, I spent most of my initial business life in food service, traveling quite a bit. Wanted to stop that at about, oh my gosh, about the age of 40.
Okay.
So changed my career, went into healthcare, went to work for a healthcare consultant and CPA that had a business, referred quite a bit of their business out because they mostly did accounting and things like that.
Mm-hmm.
Determined all the areas that they were lacking, got certified in many different areas, and started bringing all that work in-house. Took over the consulting side of the business, split off, and the rest is history. We've been doing this for, oh my gosh, um, over 25 years now. We have clients in all 56 US territories, and we assist and support clients in everything from initial practice startup, entity creation, credentialing, contracting, which is where revenue cycle begins, to supporting them ongoing with compliance work, compliance validation, chart reviews, education, recruiting, HR matters, you name it, we support them. And if we don't have the expertise, you know as well as I do, we know a lot of consultants around this country that have the answers, and no
Yep.
one needs to reinvent the wheel.
Yep. We can connect you to somebody.
Yes, we can.
I'm curious, why did you leave food service? What was it about where you
Traveling
said,
4 and 5 days a week, leaving Monday morning, coming back Friday,
mm,
missing my kids growing up. I did that for 20 plus years.
mm-hmm.
Traveled all over the country. Yeah, it got old.
Okay, yeah.
And I needed more control and a little more balance. I don't know that starting my own business up was looking really at a balance of quality of life, but now I certainly have it. And geez, I wish I would have made this decision when I was 18 versus
Yeah.
at 40.
Yeah.
But hindsight's 2020.
And then how long were you with the accounting firm before you broke off?
We were there quite a while, but I was running all the consulting side of the business, which ran it through there, really built the clientele. And when we split off, literally every client came with us, just because we were providing most of the services.
Mm-hmm.
Tax and accounting, that can be done by pretty much any accountant, bookkeeper, that type of stuff,
Mm-hmm.
or a CPA. which, we've shared clients with the old firm. But most of those clients, the consulting side of the business grew very quickly
Hmm.
because there was a huge need, and you can find CPAs everywhere. You can't find knowledgeable consultants that truly know what they're doing everywhere. They don't exist.
Yeah, and the painful part about it is that you don't know what you don't know. So you can, if you took 10 people who said I'm an expert in revenue cycle management, line them up, and you and I both know that's probably not true. But if you need to pick one,
Absolutely.
you don't know which one is, truly competent versus not. And
Yeah,
so
and
it's
if you
just it's
don't know
easy to
the
fake
job,
it.
how do you determine their competence?
Exactly.
It's kind of like a physician going to interview a billing person. How do they know? They don't know what they're getting
Correct.
because that billing person can tell them anything and they're going to believe them.
Correct. Correct.
Or their colleagues tell them, oh, this is a good billing person. Well, how the heck do they know?
Yeah. Right.
They aren't a billing person.
Right. Right. I know.
So,
I know.
yeah.
Yeah. Well, listeners, if you don't know David already, this episode is going to convince you he knows what he's talking about because ERISA is not a light and fluffy conversation. It's a lot going on, and we're going to narrow the scope in because if you were to start researching ERISA, like I did, you would find all sorts of things that we're not going to talk about today about health benefits and retirement benefits and all sorts of things like that. But there's a whole separate related part of it that dives into insurance claims. And that's the part that we want to dig into because that's the daily bread and butter for so many practices out there. So with that as a backdrop, give us kind of the lay of the land with ERISA with and just frame this up however you like with but kind of let's keep it on, not on 401ks and such and more on just the world of insurance claims, health insurance claims.
Yeah. So ERISA is basically the Employee Retirement Income Security Act of 1974.
Mhm.
1974, folks.
Yeah.
That's when it came out. It's more than 50 years old. And
Hmm.
how many health practices and medical practices and dental practices or any type of healthcare facility, how many of them know about it? Not many,
Hmm.
a very small percentage.
Hmm.
It's basically a federal law establishing minimum standards for private sector retirement and health benefit plans. So it even protects any type of employer benefit plan where it's sponsored by the employer, as long as the employer is not a government entity of any type. Now,
Okay.
that includes Parks and Rec, police, township, city, federal, state governments, all that kind of stuff,
Okay.
as well as religious organizations, parochial schools, churches, things like that.
Okay.
So, if you look on the department, this is a Department of Labor law. That's one reason why most healthcare professionals don't know about ERISA. And that Department of Labor law is listed on the Department of Labor. You can read all about it, but it's communicated in a manner to consumers. It is not communicated to providers, which is another reason why a lot of providers aren't aware of it.
Hmm.
But basically, it applies certain standards on how benefit plans sponsored by employers are to be handled and adjudicated, claims and so on.
Okay.
Okay. So, given that only 17% of the population in the United States is employed by government agencies of any type
Hmm.
and or religious organizations, which is last year's data on the Department of Labor website, that means 83% of the claims in America are covered under the ERISA Act.
Wow.
Okay? 83% of the claims. So think about it. If you've got an employer, if you've got a patient that has a health plan sponsored by their employer, and their employer is a private company that sponsors that health plan,
Hmm.
it's covered under ERISA. If the patient's covered under a plan from the state insurance exchanges that were set up with the Affordable Care Act,
Hmm.
it's covered under ERISA because that dovetailed into PPACA, which is the Obamacare regulations.
Okay.
Okay. And there were a lot of updates to ERISA based on PPACA being written and passed by Congress.
Hmm.
So you've got an awful lot of claims that are covered under ERISA, which are protected. So let's just give a couple of examples what I mean by it protects them. So think of how many of your listeners have had recoupments done by a payer where they say, you owe us money back on claims that we previously paid you, and we're going to offset that money based on the claims that are currently being communicated to us.
Mm-hmm.
And that information or that basic request to recoup on current claims for an old claim is against the law per ERISA, because the patient that the provider saw a year ago where
Mm-hmm.
they're trying to recoup on that claim,
Mm-hmm.
the current patient that they're going to take that money, offset that money from,
Mm-hmm.
hasn't given permission to not pay that claim of
Right.
theirs.
Right.
Okay. The
That's like
patient
saying you
owns the
go to a
claim.
restaurant and a customer's last week a customer stiffed me, so I'm going to double charge you to make up for it.
Exactly.
No.
Same type of instance.
Yeah. Yeah.
So the payers have no rights to basically, that claim is owned by the patient. Okay. Think
Mm-hmm.
about this.
Mm-hmm.
And hopefully your listeners are hearing this. Every medical record and every claim submitted is owned by the patient. It's not
Mm-hmm.
owned by the practice.
Mm-hmm.
It's not owned by the payer. It's owned by the patient. The patient gives you the right to bill their insurance and gives you the right to collect from their insurance. And that is based on having an assignment of benefits, an AOB, not a ABN. Everybody's going to confuse
Okay.
ABN with an AOB. An assignment of benefits is a legal document that has to be signed by every patient, and that gives you the right to bill their insurance and collect from their insurance as long as that AOB states that you are the authorized representative. You need to use those terms assigned by the patient.
So just to clarify this, it's the practice that has to have this form that every patient must sign. It's not like the
Correct.
insurance company. It's not an auto sign when you enroll in the plan. It's every practice has to have this completed by every patient.
It has to be an assignment of benefits signed by every patient that needs to be kept on file indefinitely in their record.
And
If
just
you don't have that document signed, you
Mhm.
have no legal right to bill their insurance and you have no legal right to collect from their insurance. And if a payer realizes you don't have this signed, they can and should request every dime they've ever paid the practice back, which will cause the practice to go bankrupt.
Right.
That is federal law.
And just like a really tactical question, does the AOB have to be like renewed every year
No,
or just once as long
signed
as
once and it is good until the patient basically takes back that right.
okay.
Okay. Once they leave your practice, you close your practice. Well, that AOB is no longer, it's voided. It's no longer in
Okay.
effect.
Okay.
Okay. Or if the patient, walks away from your practice, you discharge them, you have no rights for that patient any longer.
Mm-hmm.
So, yes, practices that don't have this signed, let's say that a payer requests a bunch of medical records. If you notice when a payer requests medical records, they always request intake paperwork and all valid documentation that allows you to see that patient and to
Mm-hmm.
provide services.
Mm-hmm.
That's not only the encounter, but all the intake paperwork as well.
Yeah.
And part of your intake paperwork has to be that assignment of benefits. How many practices know about this? I'm going to say not a large percentage.
Okay.
How many practices can have all their money revenue taken away from them? I would say probably a large percentage.
All of them. Yeah.
Now, payers don't always realize this, but I did have a potential client 11 years ago that came to us because they were being audited by United Healthcare. Actually, they had already been audited and they had a recoupment letter, demand letter sent to them. The provider came to us and wanted assistance. Well, we went and tried to assist them, but the decision had already been made. United Healthcare already conducted an audit, found out that he did not have an assignment of benefits. he had to return over $11 million. He is no longer licensed, no longer practicing medicine, bankrupt, and will not get a job anywhere because United Healthcare reported him. They have a Medicare Advantage plan. Any payer that works in the state, Medicaid programs, or Medicare programs
Hmm.
is required to notify the federal government and the state government of any violations.
Hmm.
And then everything starts rolling downhill. So the minute United Healthcare notified Medicare, Medicare excommunicated the provider, deactivated his billing privileges, notified the state in which he worked. The state took his license. Medicaid took his contract and terminated it. And then it took about 9 months, and every payer terminated him.
Wow.
He no longer works in healthcare
Yeah.
and will never work in healthcare again.
Yeah.
All because he never had an assignment of benefits signed, and he employed 7 other providers,
Wow.
hence the
What?
$11 million.
Yeah. What happened to them? They
They're
landed
gone as
okay.
well. I don't know the specifics about them, but this was a provider that owned the practice. All of them were employed.
Yeah.
The practice did the billing, even though each provider signed off on their charts and things of that nature. The practice was found responsible for this. And of course, they had to return all this money, so he had to
Yeah.
shut the practice down.
Damn. Damn. So, spoiler alert, the last question we ask every guest is what's something somebody can do to get started to make this better? And I'm going to say priority number one is make sure you've got the assignment of benefits box properly checked in your procedures.
Yeah, that's all. I mean, it's all about setting up the practice and making sure that you've got all the intake paperwork done properly. I mean, part of your intake paperwork is an assignment of benefits signed. Normally, we make that part of a financial policy that we document on
Mhm.
behalf of any startup to make sure that all patients know what their responsibilities are, financial and operatively, in the practice in order to stay a patient in the practice.
Yeah.
They have to sign off on it. And once they've signed off on it, then you have to hold your patients accountable to do everything that it says in that policy.
Hmm.
So not only that, but part of the intake paperwork is also validation of an um, acknowledgement or an affidavit saying that you made the attempt to obtain a signature that the patient either read or was offered a copy of the notice of privacy practices,
Okay.
which is a HIPAA requirement.
Hmm.
So it's called an acknowledgement or good faith effort form, and that is required by HIPAA.
Hmm.
Many people don't offer the notice of privacy practices. They
Hmm.
just go to the patient and say, hey, sign this that says that we showed you our, notice of privacy practices. You need to offer them a copy of it. The
That doesn't.
patient can refuse, but then they have to sign that you made an offer of a copy. And if they refuse, you don't argue with the patient. You just have a staff member sign that said they made a good faith effort to obtain a signature that you offered a copy. And a copy of your NPP must be posted in your reception area.
It's funny. I've always presumed that if I don't sign their forms, they're going to say, "Sorry, you can't be a patient here." I mean, these are our policies, and I've
Well, if
never,
that was
I've
my
never pushed it.
practice,
Yeah, I mean,
yeah.
I've never pushed it, but I've thought, these are clearly their terms. None of it sounds, um, I don't know, terribly awkward or difficult. Like, yeah, you need to keep this stuff private, and yeah, you need to be like. I've just never. I've always, if I want to be a patient here, I need to sign these things.
Yeah, so I mean, if it were my practice and a patient refused to sign the assignment of benefits, I would definitely tell the patient, then you'll have to go somewhere else
Yeah, this
because we can't
whole
help
well,
you.
acknowledge that I tried. I'm like, I don't know. That just sounds like a bad I
Well,
told
that's
you
just for the
so.
notice of privacy practices.
Yeah, but still.
Okay. But
They never showed me
that's
that. It just seems like it's a bad he said, she said, whatever, if it ever
well,
comes
that's
up.
why you don't argue with the patient.
Right.
If they don't want to sign the for the acknowledgement of the notice of privacy practices, the HIPAA regulations state we're not here to make you argue with the patient.
Right.
You need to attempt to obtain a signature, but you're not required to obtain a
Oh,
signature.
okay.
That's why it's called a good faith effort form as well.
Okay.
And there The proper documentation on that form is noted in the HIPAA regulations,
Hmm.
and we design those forms, give them to clients so they can make sure they have the proper documentation
Hmm.
for HIPAA regulations,
Hmm.
as well as what every payer is going to require or wants to acknowledge that you have in order to do this. Now,
Yeah.
the issue is that when a payer is doing an audit, most of the times those people aren't qualified. They're usually RNs or somebody else. They're not certified coders in
Hmm.
many cases. So they don't know the laws, they don't know the regulations, and a lot of times they don't even know the coding that allows them to audit these records.
Yeah.
So that's why you really want somebody that anytime you get audited or have a recoupment letter or anything like that, you want somebody to review the records before they get sent out, make sure everything's documented properly, numbered properly, identified properly. You retain a copy of everything sent to the payer
Hmm.
because you want to make sure that they get exactly what you have a copy of so that you can always refer back to it and everybody knows how many pages, what pieces of documentation were communicated, and you already know what the payer is going to see in those records. That's
Yeah.
why you want it audited before you submit everything to a payer.
And so when an insurance company says we're going to audit you, we need records, we're trying to recoup, we need to recoup. How does ERISA, how can ERISA come and be the friend of the practice, assuming the
Well,
the
normally,
AOB is in place and the appropriate things are in place?
normally a payer doesn't tell you we're going to recoup. All they
Fair
want to
enough.
do is an audit. They're
Okay.
looking to see what they can do.
Okay.
Now, everybody that's listening right now on to your podcast, this has nothing to do with the Medicare Advantage risk adjustment record request that everybody is receiving from Medicare Advantage plans.
Okay.
Although there are regulations and citations that limit those records as well and how often they can request those records.
Okay.
So if your listeners are interested in that, they need to contact either us or somebody to understand what those regulations are,
Okay.
which is separate from ERISA. But the fact is that when a payer initiates communication that they want to audit records,
Hmm.
the first thing the practice should do is contact a certified coder or auditor that's going to assist them with this project. If they aren't aware of what the proper actions are in doing this and how to handle it, then you definitely need an expert that has done this many times and knows how to handle the payer.
And here's a question. It's kind of silly as I hear it in my head. Is that typical to find in a sort of a reputable billing company? Like if you're
No,
using
most
one?
billing company, they may have a coder or two that will help identify whether services are being billed properly,
Okay.
but they aren't going to know how to evaluate medical policies at the payer, determine whether the records and all the documentation justify the services that were billed, because that's what you're looking for. The payer's looking for the errors in the documentation that are going to allow them to take the money back.
Got
You've
it.
got to remember this. Insurance companies are there to collect premiums. They are not there to pay claims.
Hmm.
Okay. They pay claims because they're required to, but they don't want to.
Hmm.
So they're going to find every way they possibly can to keep the money in their coffers.
Hmm.
And once you understand what the health insurance game is, then you know better how to deal with it.
Hmm.
Okay. So our job is to get that money and to retain that money.
Hmm.
And it's all about setting yourself up proactively so that you never have these type of issues.
Right.
Being, going on the offense, developing a plan, systems and processes to ensure that whatever money you are billing and collecting, you're going to be able to retain and keep forever.
Hmm.
Because a payer can always come back and ask for their money back.
Hmm.
Whether you are documented and everything's medically necessary and you follow the policies of each payer. Years ago, people used to have insurance carrier books. So you'd have a book on Blue Cross Blue Shield and all their policies based on the services that you provide.
Okay.
Nobody does this anymore. Nobody checks websites for updates in medical policies, LCDs, NCDs, all that type of stuff
Mm.
in order to determine whether you're following the procedures properly. Every biller has their own rules. And as I tell everybody, those who hold the gold make their own rules. And
Yes.
every insurance company has been given that power by Congress since 1974.
So what are some examples of carrier requests, I guess, that you've seen where you go, ERISA doesn't let you do that?
Well, it's no different than recouping. You can never recoup money on an ERISA claim,
Okay.
ever. I mean, they just don't have that permission. Excuse me, unless they get that permission from the patient. So, for instance, if there is a payer that requests records and they're doing it through a third party like DataFile, DataVant, Vertex, whatever,
Mm-hmm.
okay, the patient hasn't given permission for that third party to take those records.
Mm.
You need an authorization signed by that patient allowing that third party to receive those records. Just because the third party may have a contract with the payer doesn't give you the right to give the patient's records, which they own, to a third party they're not aware of.
I could easily see, even me, thinking, well, Blue Cross Blue Shield is our insurance company of Illinois. Um, they must have, I could see my assumption being, well, they have a right to that. It would never occur to me to go, wait a second, I own that. You don't own that. Like I'm part,
The
I would
payer
think
will tell you they have a right to it.
I'm a part of your plan. And so as such, just like I said a minute ago, if I want to be a part of your plan, even though it's through the school, I must be agreeing to a whole bunch of terms. One of which is if you want to see records, because you see all the PHI anyway, you're processing these things. You must have a right to that if you ask for it. And you're saying, no, that's not true.
No, it's not true.
It's good to know.
No, they don't. Third-party vendors don't have a right to it. And even if, let's say United Healthcare just requests those records,
Mhm.
technically they have somewhat of a right. But if they're auditing claims, is the patient aware that their records are going to be sent? Okay.
Mhm.
Is the patient aware that the payer may deny their claim?
Mhm.
Patient has every right to know everything that's going on with their claim and their records.
Mhm.
Okay.
Mhm.
That's in HIPAA. It's in the regulations.
Okay.
So you have to give the patient that information.
Okay.
So normally I state the payer has to have an authorization. It's not the practice's job to obtain a written authorization signed by the patient to release their records. It's
Mhm.
the payer's obligation. It's
Okay.
the third party's obligation to obtain that.
Okay.
Then they have to pay you for those records because that's the law in every state as well. And every state has, citations, state code that documents what is allowed to be collected in order to research, pull records, and supply them to anybody, even attorneys for court cases.
So if I give my
All
permission to
states document this.
I give my permission to Blue Cross, yes, you can get my records from my primary care doctor. And then so then Blue Cross has to pay the doctor to get the records.
Oh,
Is that,
absolutely.
and who sets
You
the
never
price?
should send records without getting paid for those records, for the cost of supplying those records.
Okay.
Pulling them, documenting them, scanning them, faxing them, whatever the case may be, yes, you are allowed to get paid for copies of any records requested by a payer or a third party.
Okay.
But you also need to obtain permission from that patient. And that is the responsibility of the third party vendor that the payer is utilizing or the payer. And again, I submit to you, never send records to a third party that is not the insurer. Never, ever. And that's almost every risk adjustment audit that Medicare Advantage plans are doing.
Do you mean,
Datafied, Vertex, DataVant, all of those third parties never send records to them.
oh, I see, to them. I thought, okay, yeah. Yeah.
You can
Huh.
send them straight to the payer. And I send letters to those third parties all the time telling them they're in violation. I provide citations to the ERISA regulations or any other regulations that they're violating to make them aware that the employer is the fiduciary on that health plan.
Mhm.
So, for instance, here's another example of what can't be done. How many payers are requiring prior auths that are illegal? Almost every single one. Okay. The plan, the policy, patient's policy, which almost no practice has, but that is the most important document that a practice needs The second most important document is the summary plan description for that policy.
When you say
Every patient,
the
pardon
policy
me,
of the
health insurance policy.
oh, okay.
So the employer, so for instance, Zetter HealthCare,
Hmm.
we have health insurance. I supply health insurance to every one of our staff.
Hmm.
Okay. So we pay 100% for their health insurance, vision insurance, and dental. So it's an employer sponsored plan.
Hmm.
We use Highmark Blue Shield here. And when we submit that plan, every year when we renew our plan, we have to provide a copy of the policy and the summary plan description
To the employees.
required by federal law to every employee.
Hmm.
So every employee has a copy of that or should,
Hmm.
because the employer is the fiduciary. A fiduciary has to act in the best interest of the patient covered by those plans.
Hmm.
Okay.
Hmm.
So the employer is responsible. They're also responsible for ensuring that whoever the health insurance company is that they contracted with, they have to ensure the health insurance company carries out their actions properly and legally because they're fiduciary. It set the fiduciary responsibility set strict rules for those managing plan assets, requiring them to act in the best interest of the participants. That's federal law. So the employer can be held accountable too if they allow the health insurance company to violate ERISA laws.
So how would the employer find out?
You're supposed to notify them. So, for instance,
You mean the insurance
if
company is?
no.
Okay. All
So,
right.
what happens is so let's say United Healthcare is auditing a client of ours.
Okay.
We're going to send a letter to United Healthcare. If they're in violation of ERISA, we're going to send a letter to the CEO of United Healthcare. We're going to
Hmm.
copy their attorney department and their
Hmm.
compliance department.
Hmm.
We're going to copy the employer of the patient.
Hmm.
We're going to copy the patient. And then we're also going to copy the EBSA, which is the federal agency that oversees ERISA laws and the Department of Labor regulations. All
Okay.
right. So now we're sending all this information, notifying the CEO of United Healthcare that they're in violation of ERISA. We've got the citations there. We've notified the patient that United Healthcare has not notified them of United Healthcare questioning their claim and possibly denying their services. We're notifying the employer that United Healthcare is in violation of ERISA and they need to be stepping up and holding United Healthcare accountable to follow the regulations properly.
Mm.
Otherwise, they can be fined every day for the violation, and so can the CEO and the insurance company. So you've got a lot of power behind it. You just need to know the rules. You
Yeah.
need to know how to cite the citations of the Federal Register and communicate to the proper people. Because if you're going to communicate with the claims department, they don't know squat and they aren't even going to know what you're talking about. The CEO knows what the federal laws are. The compliance department of the payer knows what the federal laws are.
Yeah.
Their attorneys know what the laws are. You notify those people. I can give you an example. A letter sent to Aetna, CVS, 6 months ago for a client.
Hmm.
Sent less than 72 hours after receiving that letter, we get a call. My office got a call from their executive department, which was an administrative assistant on behalf of the CEO of CVS, notifying us they are relinquishing their request from that recoupment request and they are canceling it because they are aware that their staff made an error in requesting the recoupment.
Hmm.
That's always going to be the excuse. But they know what they're doing and they did it on purpose because if you don't know the law, it's no different than how many denials are ever appealed? Only 50% because the payer knows nobody's going to take, half the people are going to take the time to appeal those denials.
It's easy math on that
So it's the
business
same
move.
thing.
Yeah.
If you don't know the law, you're not going to know any different, and you're going to think the insurer knows everything. They know all the laws and the rules, and they're right. Well, that is so
And they're
far from
helpful. And they're just being helpful. Yeah.
Pardon me?
And they're just being helpful. Just crap.
Yeah,
But
right.
yeah. So how often, I'll call it the letter writing strategy, how often does that get the result that, the 72 hours later or whatever it is that they back off?
Almost every time.
Mm.
I've only had probably 10 to 15 times over the past 25 years where it's taken me two or three letters. Eventually, every single letter is acted on,
Yeah.
meaning the payer acknowledges, oh, we're in the wrong. But we have to do our homework. We have to do our research.
Hmm.
We have to verify what claims are can't be recouped on or can't be denied
Hmm.
or what prior auths can't be requested. So, like if a payer requests a prior auth, if that policy doesn't say that that procedure requires a prior auth, the payer can't all of a sudden decide
It
that they're
does.
making up a new rule and they want a prior auth for
Yeah.
that type of procedure.
Yeah.
A policy dictates what the payer can do because the employer, that's the employer's contract with the payer.
Right.
And the employer basically negotiated that plan. It could be a canned plan from the payer, and it could be a fully negotiated plan that the payer and the employer came up with based on what services they want covered for their employees.
Yeah. Yeah. I
The
guess
employer's
you,
always responsible. So you include them and you educate them on them being the fiduciary and them being held accountable to ensure that their insurance company is doing the right thing legally.
yeah. Yeah. And, yeah, I guess if you tell somebody you're breaking the law and I'm about to convince you of it, and here's all the citations, everything, you are breaking the law. That's a pretty checkmate kind of move. It's not really,
Yeah,
you
and the
can't
fact that
negotiate that, you really, you can't negotiate from there.
yeah, and when you copy the EBSA, there's a federal agency and everybody sees it on the CC line at the bottom of the letter, and
Hmm.
they know everybody's been notified.
Hmm. Yeah.
They know they're going to get in trouble if they don't follow through on it.
Oh my God. I would love to just, yeah, it'd be funny to like be on the other receiving end. Oh my God, Zetter.
It
They just
works.
they just see Zetter on it. God damn it. It's freaking Zetter. Just fix it. Just give it to somebody.
Yeah, we love that notoriety, no doubt about it. I love fighting with payers every day of the week.
Yeah, yeah. It's fun to fight
It's
when you know you're
fun.
right. It's fun when you know you're right.
You have to do it properly, you have to do it professionally,
Of course.
but we know what the rules are. We hold them accountable. And as long as you know what the rules, then you need to communicate it. You scream it from the top of the mountain and let everybody know you know.
Hmm.
And eventually, I mean, right now there are several payers that know when we're involved with a client, they know who we are because we've
Hmm.
communicated with them plenty of times.
Hmm.
They know we know what the rules are and they know they're going to have to deal with this situation responsibly.
Hmm. Very good. Um, as is typical of our episodes, we cover a lot, but in that context, is there anything you think we needed to touch on that we didn't get to?
Well, all I would say is, you can either go out and download the Federal Register with all the updates to ERISA. There are a few of us consultants out there that speak on this topic, do webinars, have, day-long meetings on this type of thing, even including the request for the risk adjustment records for Medicare Advantage. There's a lot of stuff out there that practices are not aware of that protect them.
Okay.
My main comment would be to your listeners, if you don't know what all the rules are, find the experts.
Hmm.
There you can definitely, you know, get the get the proper information on a valid consultant. Good consultants are going to be able to communicate to you that they know what the rules are and prove it to you so that you know you're getting an expert that knows what they're doing
Hmm.
in order to truly assist you and fight these insurance companies because independent practice is so important to this country.
Hmm.
It's been lost since the 90s. It came back in the late 90s and early 2000s. And then, of course, it went right back around, and a
Hmm.
lot of independent practices got bought up again, 10,
Yeah.
15 years ago.
Yeah.
So we need to protect private practice. We need to protect providers. And ERISA does a lot of that.
Yeah. Which is a good lead into the other question I asked to wrap up, which is where can somebody get started to get better at this? And it, I want to say something and then ask a question. So seems to me every listener should go make sure they've got the assignment of benefits box properly checked. You've got the form, it's signed. What if you don't and you do it today? Are all claims prior to that date, you know, at risk, I guess. I don't know how else to ask.
Yeah, so technically,
Can you
yes, you could
retroactivate
have
that? Like, or
prior
no?
claims could be at risk,
Okay.
but you're better off getting it signed today than not having it at all.
Yeah.
Okay.
Yeah.
So as long as you can get that signed by your patients, we do that all the time. We pick
Mhm.
up clients every single day of the week. We're evaluating whenever we're doing credentialing and contracting for a client. We always want to review the revenue cycle process, financial policies, AOB. If they don't have it, we implement it as quickly as possible.
Mhm.
We show them how to do it, how to obtain that signature, and we'll utilize that moving forward. And
Mhm.
even if they have a brand new one, there are ways to justify prior claims and communicate with that payer that everything's copacetic and we're fine moving forward.
Okay. Okay, good. Um, David, thank you again. Thanks for coming back. Very useful
Absolutely,
stuff.
anytime, Carl.
Yeah, we will be having you on more, but thanks once again. And we've got all your contact info that you provided. It's in the show notes for this episode and your other episodes. So any listener who wants to get a hold of David Zetter or Zetter Healthcare, now you have another way to do it. Two quick points before we wrap up. First, if you're like Zetter Healthcare or us and you serve private practices, or if you're a private practice owner yourself, either way, you've got some experience on the business side of private practice, and don't overthink what that is. Something you think is boring and common is not to lots of other people. Tell us what's on your mind. Every episode show notes, there's a link, a couple of clicks. We'll get you scheduled ASAP. And also, subscribe to Practice Care. Come on, if you haven't done it already. Practice Care is one word. We're easy to find. We're everywhere on every player you listen to, on Apple, on Spotify, and YouTube. Just subscribe because we do a new episode every week, and that's the easiest way to stay up to date. Thanks very much, and until next time.